The federal government is beginning to reopen after the longest shutdown in U.S. history. Despite the progress, healthcare costs remain in limbo for millions of Americans. But the deal to fund the government does not include an extension for Affordable Care Act tax credits, which could cause healthcare premiums to more than double. Here's more. For millions of Americans, health insurance isn't just a benefit, it's a lifeline. For Mary Harrison and her family in Louisiana, that lifeline comes through the Affordable Care Act. Right now, the monthly premium for her son and husband is $178.58. But without the extra ACA tax credits, that same plan could jump to nearly $400 a month in 2026. Almost double what this family pays today.
How does that make you feel?
It makes me feel indifferent. It makes me feel like I don't really know what we're gonna do. My husband being almost 50 years old and my son, 16, just started driving.
Do you think there's a world in which your husband and son go out without medical insurance? Is that a possibility?
It may have to be a possibility, and I may just have to figure it out because I don't even know where I would put an extra $300 in our budget.
Across Louisiana, families like the Harrisons are watching Washington closely. The enhanced ACA tax credits, what make coverage affordable, are set to expire at the end of 2025 unless Congress steps in. If they vanish, millions of Americans could face premiums more than double what they pay now or lose their coverage entirely in 2026.
I don't really know what we're going to do right now. The good thing is that through the Marketplace Open Enrollment, we have, I believe, until December 15th to do it. So as of right now, I'm just going to count my blessings and I'm going to hold my breath.
For now, the safety net holds, but with deadlines approaching and prices climbing, all Mary can do is wait and hope the coverage her family depends on is still within reach.
What's happening in Louisiana is our citizens are suffering. The increases are anywhere from 29 to 59%. So people can't afford that. So in Louisiana, you're going to see people going without insurance.
Renelle Nolan is fighting for Louisiana families. As CEO of Health Agents for America, she helps them navigate a maze of insurance choices and takes their fight straight to Washington, pushing to keep coverage affordable.
Our citizens that are some of the poorest in the nation are struggling, and they're going to struggle until that extended tax credit is extended. It was extended in COVID. And a lot of people said, well, it was a Band-Aid during COVID. We don't need it anymore. It just helps the rich. Well, that's absolutely incorrect, because what happened is the prices have increased every year, every year, every year. So without that tax credit to help people purchase their insurance, they're not going to be able to afford it. So it's not a Band-Aid anymore. It's a necessity.
Renelle is on the front lines, helping Mary and families across the state navigate their options. Different plans, different deductibles, trying to keep costs manageable if the credits aren't renewed.
There's a couple of options. Number one would be a short-term medical plan. It's not an Affordable Care Act plan where it doesn't have maternity coverage and all the pieces and parts that the ACA has, but at least you can buy coverage. So you could buy a plan that's $10,000 deductible, but it's your decision. And you decide that's what you want, but at least you have coverage. That'll be one option. The other option is, are you working for an employer? Can you get on your employer plan? And then the third option would be, if you're a husband and wife, do you have a company?
There's another proposal making waves. On the Senate floor, Senator Bill Cassidy proposed a pre-funded flexible spending account, money families could access up front when they need it most. The plan even has the backing of President Donald Trump.
We're going to be able to substitute out these enhanced premiums with something which doesn't go to the insurance company, but goes to you, the patient. And I don't consider it too complicated for the federal government to adapt to, which means we could even do it in 2026.
The clock is ticking. By year's end, subsidies could vanish. Louisiana could take the hardest hit in the nation. A new Urban Institute report warns marketplace enrollment could plummet 61%. That's roughly 85,000 people, thousands of families facing life without coverage.
We don't want them to go without coverage. That's going to be horrible because people are not going to have insurance. They're going to go to the ER. They're going to go to the ER for everything. The doctors and hospitals are going to be overwhelmed.
For the Harrisons, the fear isn't just the money, it's losing stability. Without coverage, a single urgent care visit or ER trip could wipe out their savings.
I was hoping as soon as November 1st happened and the sticker shock got up to Washington, they'd see, but they're not there. So if they're not there, we're trying to get a hold of them. They've got to see it.
Ronell and her team aren't giving up. Every call they make, every moment they advocate could mean the difference between a family getting the care they need or facing a crisis. Across Louisiana, their work is hope in action.
But none of them are giving up on their clients. I know Ronell won't. I know her full Bulldog staff will not give up.